hope you all are all right. My name is Jamarl Thomas. This is the Progressive Soapbox. I had this story lined up for yesterday, and I was too tired to do it. So I could hear my wife's voice in my ear, go to bed. So I am here with a renewed vigor to do the story. And there's another angle on the story that I get to approach. So shout out to my wife. Take a look at this. Beautiful property. This is the Salamander Resort and Spa. This is in Middlesburg, Virginia. Why am I showing you this beautiful Forbes 5-star place? This resort and spa was a location to a bipartisan group of Democrats and Republicans that went there roughly last month. I would imagine hors d'oeuvres, amazing Virginia wines, and above all else, a lusty lobbyists licking their ears and running credit cards through their assholes, all to stop Medicare for all. Oddly enough, this was paid for by lobbyists, which is somewhat amazing since lobbyists are not supposed to be able to pay for those things. I'm going to get back to that point a minute later, but I don't take issue with the place. I would imagine the location is a very beautiful location. My issue here is with the congressmen, Democrats and Republicans, but more so Democrats, because Republicans are already on this ticket, that went here, listened to these lobbyists, talked to them, and explained to them how horrible Medicare for All would be for the system. This group is called Center Forward. I'm not joking. It literally is called Center Forward, in which case they push centrist policies to Democrats, especially on this thing of stopping Medicare for all. One of the interesting policies that these guys were pushing for, that they, this kind of radical reimagining of healthcare, is on Medicare Part D. And I love this part because I found this one to be extraordinarily interesting and endemic of what they're proposing and why they're proposing it. Centers Forward, and by the way, Center Forward used to be Blue Dogs. These are Blue Dog Democrats. This is an organization. The event was hosted by a group called Center Forward and featured a lecture from industry lobbyists, which leading the charge to undermine progressives' healthcare proposal. Center Forward was originally known as Blue Dog Research Forum. If you have to change your name from Blue Dog to something else, you already have me on edge, because it seems like you're being disingenuous or you're trying to lie to me. Center Forward's big idea on Medicare D, for instance, is maintaining lobbyists' authorized provisions of the healthcare law that bar the government from bargaining for lower prices. So understand, in other countries, there is bartering for lower healthcare costs, meaning the government itself can step in order to deal with the cost of healthcare. Do you remember during the election, Donald Trump didn't do it for real, but when Donald Trump said, look, I'm going to I'm going to tether the United States prescription drug for cancer drugs or certain medications to other countries. Those other countries bartered for the cost of their drugs. Donald Trump couldn't come out and say he wanted a socialist healthcare, or at the very least for drugs. They want to stop that. So let's go into why. The big idea on Medicare D, for instance, is to maintain lobbyist-authored provisions of the law that stop the government from bargaining for lower drug costs. Such restrictions cost taxpayers and patients $73 billion a year while boosting the profits of drug makers. Isn't it awesome? We need you to keep government out of this so we can continue to make our profits. More hors d'oeuvres? Yes, more hors d'oeuvres. More hors d'oeuvres. That wine is really good. Well, yes, it is. Tell me more about stopping Medicare for all. Democrats and Republicans. At the very end of this is the part that I find amazing. How do they do this? Because this is illegal. The notion that a lobbyist is going to get a congressman, for all intents and purposes, how is that not bribing a congressman with drinks and trips and Backrubs and so forth? There's a loophole. Let's hear the loophole. The Ethics Committee's rules bars registered lobbyists from arranging luxury trips for Congress. Although Center Forward's board is made up of almost entirely of registered corporate lobbyists, the event forms were signed by the group's executive director, Corey Kramer, who is not a registered lobbyist. Oh, isn't that awesome? Isn't that awesome? Look, it's illegal to do this. We can't legally just buy politicians in this way. That's frowned upon. However, if there's the technicality that the guy who signed the papers is not a lobbyist, fair game. Welcome down to Virginia. More hors d'oeuvres, more drinks. Wes, why, thank you. Is this legal? Yes, it is. It's totally. Corey Kramer, who is not a registered lobbyist, a technicality that has helped hide the prohibition of lobbyist-funded travel. The form shows that the group spent as much as $560 per congressional aide for transportation, food, and lodging. Per aide. The host list speaks for itself, said Wendy Porter, president of Business Initiative for Health Policy. This event wasn't about fixing the healthcare system. It was about protecting healthcare industry, no matter the cost to patients, families, workers, and employees. Again, the provision that prevents the government from negotiating or prevents Medicare from negotiating for drug prices allows drug companies to increase those prices. What was that drug that they increased like 1,000% or some obscene amount? It went from like $1 to $1,000. I guess I'm making a point. This is explicitly done to stop Medicare for all and explicitly done to prevent the government from negotiating with drug factories or drug prices. I know people, or at the very least I've spoken to pharmacists, where her and I got into this conversation and she went off really angry about this notion that many of the people who came to get their insulin medications cut it in half because they couldn't afford the entirety of the costs. Blame these guys. Because ultimately these guys are ensuring that their healthcare companies' profits stay high. God, that Virginia wine is so good. Those Backrubs are amazing. The industry is the root of the cause of our healthcare crisis. No, I'd argue the capitalistic impulse that says maximize your profit. The industry is part of that system that tries to maximize their profit. You've told them that was okay, so they're doing it by hook or by crook. Morality doesn't necessarily play a part of it. It's a corporation. It's a machine. It's doing its job. We, those congressmen, are not doing theirs. A congressional staff were serious about finding solutions wouldn't touch that retreat with a 10-foot pole, he added. Agreed. My reason for showing this is because ultimately there's a full court press. It's not just this retreat. There are plenty of these. Look at this. How much did health CEOs make this year? Aetna, $58 million. Humana, $27 million. Cigna, $19 million. United Health, $21 million. WellCare, $21 million. They're making millions in profit, the CEOs, by denying you coverage. Their business is literally breaks, bones, cancers. This is an industry that is maximizing your profit off of other people's misery and failings. Let's keep going. And by the way, the unnecessary, entirely unnecessary. Healthcare industries have assembled a small army of lobbyists to kill Medicare for all. This is New York Times. That's a whole different article. Here's another one. Is this more? There's more. 1 in 3 GoFundMe campaigns for medical bills. Think about that. 1 in 3 of the GoFundMe accounts are for medical bills. And your congressmen are hobnobbing with lobbyists and trying to keep those bills high to ensure that their profits remain. Here's another one. Pharma is funding a Democratic think tank trying to derail Medicare for all. All of this is the army, the millions to billions of dollars that these guys are investing into stopping a program to lower the healthcare costs of Americans. We pay twice as much as anywhere else in the world. It's not because we get additional healthcare. That's the key point that needs to be understood. I'm pretty sure the salamander spa is at a beautiful place. So don't misunderstand me. My issue here is with the congressman. Pursuant to that, and knowing that there's an army of people trying to stop Medicare for all, it behooves the public who wants Medicare for all, who's paying attention to this notion that Medicare for all, is that everybody who says they're for Medicare for all is not for Medicare for all. And it behooves you to understand that when you're listening to these guys promising this or that, but not having the track record to back up the things that they're proving. In this case, let's bring in one congressman, Kamala Harris, Senator Kamala Harris. Kamala Harris is being asked about her statements on Medicare for all. When Bernie Sanders is asked about Medicare for all, he's very clear and unequivocal of what he means by it. If I'm not mistaken, authored bill. What does Kamala Harris mean when she hears the word Medicare for all and when she says she's advocating and on board for Medicare for all? She seems to not know what that is. Come on, Twitter. What are you doing? What are you doing? Okay, Twitter's frozen on me. Let's try this again. All right.
But you support the Bernie Sanders bill, which essentially gets rid of insurance.
I support Medicare for all, but I really do need to clear up what happened on that stage.
Okay.
It was in the context of saying, let's get rid of all the bureaucracy. Let's get all of the ways.
Oh, not the insurance companies.
No, that's not what I meant. I know it was interpreted that way. If you watch the tape, I think you'll see that there are obviously many interpretations of what I said.
Does she not know what Medicare for all is? I mean, it's named Medicare for all. If you're talking about Medicare for all is pretty clear on its connotation. It means everything. If everybody has Medicare, what space is there for insurance companies? Now, don't misunderstand me. Even when Bernie Sanders is asked about it, Bernie Sanders makes the point that if insurance companies want to stay in that terrain, fair enough. But at least for the average American, each and every person born in this country, congratulations. We've evolved as a society to the point where your birthright is healthcare. Everybody is eligible. Everybody has it. Medicare for all. It's in the name. What did she miss? Let's let her explain, because I don't necessarily know why she's unclear on what this means.
What I meant is let's get rid of the bureaucracy. As it relates
But the bill
to Medicare,
gets rid of insurance.
But no. I support Medicare for all, but I really do need to clear up what happened on that stage.
Okay.
It was in the context of saying, let's get rid of all the bureaucracy. Let's get all of the ways.
Oh, not the insurance companies.
No, that's not what I meant. I know it was interpreted that way. If you watch the tape, I think you'll see that there are obviously many interpretations of what I said. What I meant is let's get rid of the bureaucracy. As it relates to Medicare,
but the bill gets rid of insurance.
But no. It does not get rid of insurance. It does not get rid of insurance. And listen, and let me just tell you where I am. Let's tell you where I am.
All right.
I support Medicare for all. It is my preferred
As a principle, you mean, not Bernie Sanders' bill?
I support the bill.
Okay.
I support the bill.
Because the bill gets rid of private insurance for everything that
it doesn't get rid of supplemental insurance.
Right, for cosmetic surgery, but for all...
So it doesn't get rid of all insurance.
Okay, it doesn't get rid of all insurance, but for all essential health care benefits.
But why? Ask the question why. The question, the answer to that question is because Medicare for all and the vision of what it will be includes an expansion of coverage. So Medicare for all will include vision, it'll include dental, it'll include hearing aids.
There are a lot of members of unions, for example, who like their private...
I gotta be honest, I have no idea what I don't know what she just said. I have no idea what she just said. Are you for Medicare for all? I'm supportive of that, but let me explain what I mean. The bill gets rid of insurance. Well, not all. Yeah, but I'll just say this. That's clear as mud. If you ask Bernie Sanders if he's trying to get rid of insurance companies, he says yes, it's his bill. Jake Tapper is asking her something very basic. Are you on board for Medicare for all? Yes. So you're for getting rid of insurance companies. Wait. But his bill is for getting rid of insurance companies. What are you talking about? Understand why Jake Tapper is asking this. Bernie Sanders' bills get rid of insurance company by expanding coverage to everybody. And if you ever hear Tulsi Gabbard talks about this, Tulsi Gabbard would say, look, I'm not trying to get rid of insurance companies. But somebody would make the point to her, but the bill expands coverage to that point. Yeah, no. Now, she's big, and she would say this with a devilish smile. Because what she knows is Medicare expands coverage for everybody. The point of the bill is to expand coverage so everybody has it. Meaning, what's the point of insurance companies if everybody has insurance? And if I'm not mistaken, there is a provision where insurance companies can't necessarily cover something if Medicare is covering it. Like, can't have duplicate coverage in that sense, meaning it crowds them out the market. Now, for supplementals, yes. But I got to be honest, hearing Sanders talk about this and hearing her talk about this are dramatically different. I have no idea what she just said in this. And to be fair to her, let me play it again without interrupting so you can hear to see if you are on board with the Kamala Harris version of Medicare for all that doesn't quite understand what Medicare for all is.
Private insurance and the plans that have been negotiated on their behalf and don't want that replaced.
Well, listen, let me just tell you something. that.
Well, you support the Bernie Sanders bill, which essentially gets rid of insurance.
I support Medicare for all, but I really do need to clear up what happened on that stage.
Okay.
It was in the context of saying, let's get rid of all the bureaucracy. Let's get all of the ways.
Oh, not the insurance companies.
No, that's not what I meant. I know it was interpreted that way. If you watch
the bureaucracy and the waste is the insurance companies. So let's also be very clear. These guys have a responsibility to maximize their profit. That's what they're going in it to do. Obamacare was trying a goal to curtail their profits, and this kind of utopian notion that you can give people awesome health care while also curtailing the profits of these guys who has a fiduciary responsibility to maximize their profit. Now, all of these different insurance companies, all of these guys increasing the profits, that's waste. If you look at what Medicare spends for overhead, who is not trying to maximize his profit, who does better, just as good, and I would argue better, than insurance companies because of it. This is not an area to which insurance companies need to be. And this notion that people care about their insurance companies, people just care about their health care. They're just concerned that a governmental program will somehow inhibit that. Let's hear.
the tape, I think you'll see that there are obviously many interpretations of what I said. What I meant is let's get rid of the bureaucracy. As it relates
but the bill
to Medicare,
gets rid of insurance.
But no. It does not get rid of insurance. It does not get rid of insurance. And listen, and let me just tell you where I am. Let's tell you where I am.
All right.
I support Medicare for all. It is my preferred
As a principle,
policy.
you mean, not Bernie Sanders' bill?
I support the bill.
Okay.
I support the bill.
Well, because the bill gets rid of private insurance for everything that
it doesn't get rid of supplemental insurance.
Right, for cosmetic surgery, but for all...
So it doesn't get rid of all insurance.
Okay, it doesn't get rid of all insurance,
Right.
but for all essential health care benefits.
But why? Ask the...
It feels like she's being deceptive. And maybe that's why Jake Tapper is asking the question in this way. I don't think I'm being unfair to her. Jake Tapper is asking her in this very specific way because it seems like she's being deceptive. It seems like you're hiding behind words. The bill gets rid of insurance. Well, not all insurance. Yeah, but for all practical means, to get rid of all insurance. Not cosmetic surgery. Yeah, but we're not talking about cosmetic surgery. We're talking about cancer treatments and back treatments and dialysis treatments. We're talking about the basic ways that people use healthcare insurance, and that's not cosmetic surgery. So you know what he's talking about. So what? Oh, it's aggravating. I'm going to let it play out, and let's let it play out.
Well, you support the Bernie Sanders bill, which essentially gets rid of insurance.
I support Medicare for all, but I really do need to clear up what happened on that stage.
Okay.
It was in the context of saying, let's get rid of all the bureaucracy. Let's get all of the ways.
Oh, not the insurance companies.
No, that's not what I meant. I know it was interpreted that way. If you watch the tape, I think you'll see that there are obviously many interpretations of what I said. What I meant is let's get rid of the bureaucracy. As it relates
but the bill
to Medicare,
gets rid of insurance.
But no. It does not get rid of insurance. It does not get rid of insurance. And listen, and let me just tell you where I am. Let's tell you where I am.
All right.
I support Medicare for all. It is my preferred
As a principle, you mean, not Bernie Sanders' bill?
I support the bill.
Okay.
I support the bill.
Well, because the bill gets rid of private insurance for everything that
it doesn't get rid of supplemental insurance.
Right, for cosmetic surgery, but for all...
So it doesn't get rid of all insurance.
Okay, it doesn't get rid of all insurance, but for all essential health care benefits.
But why? Ask the question why. The question, the answer to that question is because Medicare for all and the vision of what it will be includes an expansion of coverage. So Medicare for all will include vision. It'll include dental. It'll include hearing aids.
There are a lot of members of unions, for example, who like their private insurance and the plans that have been negotiated on their behalf and don't want that replaced.
Well, listen, let me just tell you something. I completely agree with those members of organized labor who have negotiated for plans and have, in those negotiation processes often given up what could have been higher wages in exchange for a higher coverage for health care. And we have to address that. It's a legitimate concern which must be addressed.
I don't get this, man. You can't have it both ways. I'm sorry, you can't. And I get what Jake Tapper is kind of making this point here of, it seems like you're trying to have it both ways. Now, it's like, yes, I agree with the unions. You agree with them on what? They gave up certain things. Yes, that's true, but we're not... At my last job, and even in my wife's job, every year they had a different healthcare insurance plan. They did so because the companies were trying to find ways to lower the costs, in which case they would try to find companies that were cheaper. Every year. Like, so this notion that, oh my God, people are going to fall apart if they have to give their health, they have to give this up every year, every time they're working. This is talking about a certain degree of stability. Whatever the union had to negotiate in order to get whatever they had to get in their negotiate plan, we're talking about all of the basic necessities, meaning everybody gets a Cadillac plan. No, these kind of ancillary services may not necessarily be included. But what is the value of a plan that the union will negotiate when that stuff is already built into the healthcare part? Let the union negotiate for his wages. The healthcare doesn't have necessarily have to be on the PAL as one of the things that it needs to negotiate. I don't understand why this is such this thing where she has to agree or disagree with Jake Tapper on this point. Just make the point. At the point where healthcare becomes maximized for everybody, that's not necessarily something that needs to be negotiated. Clear as mud, Kamala Harris, who's fighting backwards for her support for Medicare for All, even though I got to be honest, listening to this interview, I still don't know what that entirely means. And I strongly suspect Jake Tapper doesn't either. Saying I support something is not the same thing as I get up in the morning going for it. Within the context of what I've shown you today, Salamander, Spine Lounge, the amazing Backrubs, this push that healthcare lobbyists and insurance companies are assembling, meaning the army that they've been assembling. The fact, and this goes in Big Pharma, dedicating think tanks to this stuff, and juxtaposed, in Congress and lobbyists, juxtaposed against the difficulties that real people are having based on healthcare needs. Do you want to trust somebody who seems, unsure of herself on this very specific
Bernie Sanders
issue
bill, which essentially
to implement Medicare for all? I guess my point is this: with what you know, with the army that's been assembled for this, and her, corporate Democrat, being squishy on this particular issue, is this really the person you want to trust to get Medicare for all over the finish line? I guess my point is this: be very clear that regardless of what somebody says, it's something different than whether or not they believe it or whether or not they would even do something about it. And if they're squishy here, do you really want to take the opportunity of trusting them once they get into that office? I have no idea what her position is on Medicare for all. Seeing as she's just recently come into it, it doesn't seem to be something that burns into her. Kamala Harris, not knowing the definition of Medicare for all. And I have a super chat. Baltazar, unfortunately, Bernie's bill is still a buy-in program that allows space for private insurance to still exist. Temporarily, Jay Powell's bill does not. Baltazar, I feel you. But when anytime Sanders is asked about this, and they said Bernie Sanders is trying to get rid of insurance, Bernie Sanders is damn right. And Bernie Sanders, when talked about it, made the point that he wants to essentially lower the age for people with Medicare until it gets to the point where it covers the entire nation. It doesn't sound like he's trying to have this kind of Medicare for some. It sounds like he's full on in with this notion of getting rid of health insurance. Well, you know what I mean. Getting rid of it in the context of just main basic plans. All right. Jamal, by virtue of being a politician, you would be suspect, but I would love you to be a politician. Yeah, I'd be suspect in general. Yeah, I think I'd be suspect as a politician, and maybe this will bite me in the ass. Not because I would like demur on policy stuff. I would be who I am in the sense of wanting to get things what I want to get accomplished. The problem would be on how would you go about getting those things accomplished. That would be my problem. My problem would be what are the limits in trying to do the right thing? Like, are you okay doing really bad things in order for really good objectives? And at what point does, doing those bad things overshadow the things that you're trying to accomplish? Those are the dilemmas I think I would end up in if I was into politics. But I am in media, and so my job is just to report on that stuff. So, but, all right, I'm going to end this because I have other stories that I want to do today. Let's see. Bob Romero said, Jamal must be going soft to see if you try to get the TYT crowd these days. Or you're just overly cynical. The other part to this is it's possible that the TYT crowd is starting to wake the fuck up. There's also that. All right, I'm going to end this. If you guys hand banana need double down on that one. What? All right, I have no idea where you guys are going on that one. So I'll end this here. If you guys enjoy the content, please feel free to share, like, subscribe, and of course, you guys can always support this content through PayPal or Patreon. Thanks all. I'll see you in a few.